Hi everyone, it's Rob Arntfield speaking to you, and today I'm going to speak to you about Doppler principles and how they relate to point-of-care echocardiography. This screencast will not be a complete treatise on Doppler and Doppler concepts. Doppler is an enormous topic as it relates to ultrasound and echocardiography. And really, this is going to be an appetizer that's going to introduce you to some terms and concepts that will get you started with the more advanced concepts in echocardiography that we are using at the point of care, and will allow you a language to understand and hopefully apply the concepts we will be talking about in subsequent modules in this institute. So Doppler is really the language of flow and direction, and hemodynamics in echo are really all about flow and direction. So in order to do hemodynamic determinations such as valvular assessments or determination of stroke volume, you really need to speak the language of Doppler. Many of us are familiar with the Doppler principle, which governs pretty much everything we're going to talk about from here on in, and that is that a moving object, in most cases for us in echo a red blood cell, will have a changing frequency depending on whether it is moving towards the probe and therefore have an increasing frequency it emits, or away from the probe where it will have a decreasing frequency. And we can harness this principle in a number of different ways and techniques, as we'll discuss, to be able to provide us with valuable information about the direction, speed, and even pressure of blood flow and chambers. Now, there's a number of different types of Doppler that we can use, and the one we are most familiar with, I expect, is color Doppler. But spectral Doppler, or more graphically represented forms of Doppler, include pulse wave Doppler, continuous wave, and tissue Doppler. Now, we won't be talking about tissue Doppler today, but it is really an extension of pulse wave Doppler. It is important to understand that when trying to determine Doppler phenomena and the shifting in frequencies that occurs with moving objects, being parallel to those objects allows us the most accurate determination of their Doppler shift. So when insonating an object, we're seeking to characterize its flow, try and get as parallel as possible. Real life, of course, gets in the way sometimes of that ideal scenario, and being slightly off axis generally, especially for point of care echo, allows us the spirit of what we're trying to capture without a significant degradation in quality of our information. However, being perpendicular to something you're trying to get meaningful Doppler information about is really a non-starter. And this is unlike 2D ultrasound, of course, where our resolution of our structures is best when we are perpendicular. So these two things, not surprisingly, are a little bit at odds with each other. So if you're perpendicular, try and find a different view, a completely different view, or modify your axis to be able to get a little bit more parallel when thinking about putting some Doppler on a structure. Now, color Doppler, as mentioned, is the most familiar to us, and it is a graphical portrayal of blood flow, at least when it comes to echocardiography. And the BART mnemonic governs most of our understanding of this at the early stages, and that's, of course, that blue color reflects flow away from the transducer, and red color reflects flow towards the transducer. And for those of us who struggle to remember this, we simply can look at the color map, which will always be on any ultrasound screen when you engage color Doppler, to tell you how it is choosing to code this direction of flow. And so you have the color information always that will show you the direction towards the transducer and away from the transducer. As well, these numbers, which we'll talk a little bit more about, represent the speed with which the ultrasound machine is sampling that blood flow, and we'll come back to that in a minute. Now, color relies on pulse wave Doppler physics, which is something many of you may not have known, and as such is subject to something called aliasing. Now, aliasing is a failure of the system to be able to adequately keep up with the velocity that it is trying to resolve. And so this only occurs with pulse wave Doppler and not with continuous wave, as we will emphasize a number of times through this tutorial. And that is, of course, because when you're using pulse wave Doppler or color, you can think about the fact that the ultrasound machine is sending a signal, a Doppler signal to that particular area and must wait for the return signal. And so it's kind of a send and receive cycle that is at the heart of color and pulse wave Doppler. And whenever you have a cycle like that, a resolution cycle, that cycle eventually can be maxed out. This is familiar to us from more day-to-day encounters when it comes to other fast-moving objects. For example, in this case, the wheel of a race car, where the sampling rate of the video camera, the frame rate, it has a upper limit, and it's seldom exceeded, except when you get in revolutions as quickly as this wheel does. And this is familiar to us, as you'll see the wheel right now starts turning the opposite way, despite clearly that being impossible. And so this idea that sometimes the speed of our resolving object, so in this case a video camera, in our actual case that we're discussing in this tutorial, an ultrasound machine, can be exceeded and provide misinformation, is really at the heart of aliasing. And we'll come into this real examples of this in echo shortly. So this is a typical Doppler screen, color Doppler screen of an apical 4-chamber of fairly marginal 2D quality, but the color information seems actually pretty good. And you can see that the mitral inflow to the left ventricle, of course, is towards the transducer, and so it is portrayed as red, and the blue outflow during systole is blue, in keeping with our color map here. Our color map again also shows us the Nyquist limit, which again is the speed beyond which we will see aliasing. And we actually see some aliasing here, and I expect some of you may have caught this already, where you see there's red flow, then blue flow, then red flow. Well, if you were to take that literally, that would mean that flow is going forwards, then backwards just for a period of time, and then forwards again. When in actuality, this flow here that turns blue is simply too fast for the pulse wave Doppler physics to resolve, and so it assigns a incorrect value of it moving away from the transducer rather than towards the transducer. So this is no different than the sports car wheels spinning in the opposite direction. Now, in order to avoid aliasing and maintain the integrity of your color information as best as possible, there's a few steps you can take to optimize things. One of the most basic things that we see is that people use a color box that is far too large for what they actually need. And so if you choose a color box that covers the structure only of interest, for instance, a valve, and say its receiving chamber would be the common example, that's the right size for the color box. So use the smallest one you need, and you'll have better quality information. The other issue, as we've mentioned, is of course to be parallel to what you're trying to resolve with Doppler. And try to have a acoustic window that is very good, because ultimately the quality of your 2D image will generally be a marker of how good your Doppler information is going to be. So if you have a lousy image and you can barely make out the anatomic structures, chances are the machine is also going to have a bit of trouble resolving accurately the directions and velocities of the red cells you're looking to clarify or characterize. And avoid putting color on deeper structures. If you're at 30 centimeters and trying to figure out the flow at something that deep on the screen, you're going to find that there's going to be a lot of dropout at that depth, and your color information might be a little weak. So back to this clip again, and as we talked about, color Doppler is really a kind of a pulse wave Doppler for dummies, if you want to think of it that way, where it's giving you this nice, easy to read blue and red portrayal of flow, which for the most part serves us very well in many cases. For instance, it can show us here the little trace of mitral regurgitation that's seen here. So often color is the first stop. Even for the most advanced people, color is a extremely valuable tool. But you really need to know what underlies it, and that is spectral Doppler. So this is an example of a spectral Doppler trace, and I want to take you through this for a couple moments. So with the spectral Doppler trace, this is kind of the source code for the color Doppler, and you have velocity information here on the side, and the blood flow is portrayed graphically. You can see a baseline here, which would represent no flow whatsoever. Flow above the baseline is the equivalent to flow towards the transducer, and so that would be in a color world, that would be red flow. And here, instead of showing you a bunch of red pixels, it's simply showing you the flow above the baseline that tells you it's towards the transducer, and the velocity and timing of those events relative to one another. Of course, below the baseline, you can imagine that is flow away from the transducer, and this is would be the equivalent of blue flow on color Doppler. So as mentioned before, there's a few different types of spectral Doppler. There's pulse wave, continuous wave. So as mentioned before, there's a couple different types of spectral Doppler we will be talking about. We've already spent some time referencing pulse wave Doppler, and we'll also talk about continuous wave Doppler. Now, pulse wave, as we've inferred, is a tool designed for spatial precision. It's the ability to resolve a velocity at a very particular location. And this, again, is very clear to us from color, where we move a box around on the screen wanting to get the information just at those locations. So pulse wave is unique in this way that it can provide us with the information from a particular point, but it suffers, of course, the downside of aliasing, which we've already mentioned. So it cannot keep up with seriously fast velocities. And we will see this in a couple examples. And now, when actually using pulse wave, you want to place this, what appears to be an equal sign, which is a sampling gate, into the exact area where you want to get the velocity. Now, the good news is that for fast-moving flows and for high-speed jets, we can use something called continuous wave. So continuous wave is the tool we use when we're interrogating very fast velocities. And regrettably, however, we will lose the spatial precision that we enjoyed with pulse wave Doppler. So continuous wave offers us the ability to resolve the fast jets, but can't provide us the exact location of these jets. In reality, these two modes work in fairly excellent harmony most of the time. The biggest issue is, as an operator, you must understand the differences between them and why and how to employ them. But once you have this mastered, the good news is you can weave between the two modes to accomplish what you need and answer the questions you need. So let's look at a basic example of color Doppler. This will be familiar to many of you. We're here using a DVR recording of what is a transesophageal echoes mid-esophageal four-chamber view. And what I want to highlight is not the view, but just the way the operator is manipulating the color box size, manipulating the Nyquist limit. It started in the 60s. We're now up to 75. So the higher the number means the least aliasing. And what they're trying to do here is assess for mitral regurgitation. And what you can see is they've made it the perfect size to cover the mitral valve and the receiving chamber of the left atrium, no bigger. And we're capturing just a trace amount of unimportant and mitral regurgitation, that whiff of red flow there. You can see here now they move over to the tricuspid valve, and though our axis is far from perfect in terms of being parallel, we may capture a smidge of tricuspid flow, but I would be mindful in this example, if I was the operator here, that the flow seen here is likely underestimated because we're so far off axis. So this would be a common everyday example of optimizing color Doppler and both its pluses and minuses. Let's look at an example of pulse wave Doppler. So this is an apical 5-chamber view. And what I want to show you here is that, firstly, I can imagine the operator here is going to be looking for probably a sampling of a stroke volume. And for stroke volume determination, as we'll talk about in a subsequent screencast, you want to place a pulse wave Doppler gate in the left ventricular outflow tract. So in order to engage the Doppler mode, the spectral Doppler mode, the user presses the Doppler key, not the color key now, but the Doppler key. And many of you have probably accidentally done this at times and brought up the pulse or continuous wave sampling lines and not known entirely what to do with them. But now you will. So here the person pressed Doppler. They brought up this sampling line, which you might recognize is not the pulse wave Doppler line. It is the continuous wave with the diamond shape. So what you'll see next is that the operator changes the sampling type to being pulse wave. So now you see PW down here, we see this equals sign, which is the sampling gate, and now we're in pulse wave mode because the operator thinks I'm using pulse wave because I want spatial precision. I want to sample the volume from exactly this location, which could not be given to us by continuous wave. It would sample the entire length of the sampling line. So now we have to say, well, are we parallel? Well, flow is going to this way, the sampling gate is this way, so we're probably at a 30-degree angle. So we might try and optimize our view a little bit to try and get more parallel. And whatever result we have, we might acknowledge that it might be underestimated a little bit because of the fact that we're a little bit off axis. But all the same, the operator then presses the Doppler button once more to engage the spectral Doppler tracing. And what you can see here is that they're acquiring in real time systolic events as represented by flow underneath the baseline, moving away from the transducer towards the aortic valve. And you can see that these systolic events are occurring regularly, so the patient's probably in sinus rhythm. And as we'll show in future screencasts, this information can tell us a lot about the patient's cardiac output and stroke volume by obtaining some parameters related to its flow and some other details we'll need from the echo. So that's pulse wave Doppler, so spatial precision. And lastly, we're going to look at continuous wave. So here we already have color Doppler in place, and we have a significant tricuspid regurgitation jet that is seen here in this apical 4-chamber view with the dilated right ventricle and big color flow going into the dilated right atrium, probably a chronic condition. And the operator has chosen a continuous wave Doppler signal because they're actually going to try and resolve the velocity of this jet. If they were to use a pulse wave Doppler signal, it would result in completely uninterpretable information because the machine would be unable to resolve velocities of this speed. So the operator is going to place the continuous wave Doppler line through this jet, and they're going to be trying to resolve something called the RVSP, which we'll talk about in a dedicated screencast later. But the important thing to know is that this is a fast jet, and so fast jets mean you need continuous wave. So we can see here they're going to put the continuous wave right through the jet, and again that's going to generate a spectral Doppler trace. The baseline is adjusted so that the regurgitant envelopes can be seen more clearly, and you can see the operator now engaging the calipers to do some calculations, which we'll talk about in a moment. But what you can see here is a couple things. The velocities are almost 3.5 meters per second. Pulse wave really can't exceed typically about 1.5 meters per second. So these are velocities that only continuous wave can handle. And the other piece to notice is, or that I'd like to point out, is that this Doppler line, this diamond symbol, doesn't really matter where it is. It's considered a focal point, but don't get too fixated on where it is. Just put the line through the jet you want to sample or through the structure you'd like to sample. Of note, and we're going to talk about this in a moment, the velocity, which is 3.5 meters per second or 352 centimeters per second here, is converted to a pressure by the machine. And that is a hugely important feature of Doppler as well, but it's not really Doppler. That phenomenon belongs to a fella named Bernoulli. And Bernoulli described a number of important physical concepts, and ultimately we use the concept of the simplified Bernoulli equation to turn speeds, so velocities, into pressures. And now this is a much larger topic of physics, but ultimately trust me that we can do this using the equation 4v squared. So if you can resolve the velocity between two chambers, then you can resolve the pressure gradient between those chambers. And that governs a huge amount of what we're going to talk about in hemodynamic determination. So in this example, again, you saw, this is a separate example here where we see somebody resolving the velocity of a very fast jet, 4.5 meters per second, and you can see then that we have a gradient that is displayed as a result of this. So that is simply the machine punching in 4 v squared, 4 times 4.5 squared is 83.4. So the good news is the machine will do the math for you, and there'll be lots more exciting examples of how to apply this and why this is relevant to you at all in the coming screencasts. So I have some final thoughts, which to reiterate and conclude with, and that is that Doppler is the language of flow and hemodynamics. It is not perhaps as exciting as some of the other topics we're going to cover, but it is the necessary building blocks to safely and competently apply some advanced techniques. You have to understand color, pulse wave, continuous wave, and the concept of aliasing. And we're really looking forward to showing you how to apply these concepts in subsequent modules. Thanks for your attention.